My name is Gasia, Mikaelian. I'm an anchor and reporter at KTVU Fox 2 News in the San Francisco Bay Area. Today we're talking about how the COVID-19 pandemic specifically is affecting older Americans and what we can all do to help them. I'm happy to welcome to this talk Julie Nags. You're the co-owner of Synergy Home Care. Thanks for being with us, Julie.
Thank you for having me.
How are older people specifically being affected by the COVID-19 pandemic, whether they have the coronavirus or not?
Well, it's quite a difficult moment because for people who normally have trouble perhaps getting out of the house on their own or don't feel confident doing so, or perhaps may lack transportation to get out reliably, or may lack connection because they live alone, it is a very difficult equation.
Can you tell me about some of the ways we can be good neighbors?
Absolutely. What I would say is ask questions of a friend or neighbor you may wonder if they are experiencing loneliness or feelings of isolation. So ask questions like, are you able to get out of the house reliably? Would you like me to facilitate a phone call with a loved one? You could perhaps talk to this person's family to see if they feel that this person needs some touch points or to be attended to, and that could come in the form of a caregiver from an agency like Synergy Home Care. So there are many ways to connect. The idea would be just to help in whatever way possible. Maybe help with a regular phone call, maybe help to set up an event where someone could social distance but yet still have a visit from a friend. Promote COVID preparedness, wearing a mask and setting something up appropriately so that it goes off well and people feel safe and confident.
I know in the early weeks of the pandemic, we would be out walking around in our neighborhood and there was kind of one home that we've always admired because it's so beautiful. And one day the owner of the home happened to be outside and he was quite elderly and we talked and it struck me and I said, do you need any groceries? Because here I am, I was limiting my trips to the grocery store. So when I did go, I would buy for myself and for my parents, and if a neighbor said they needed something, but I thought, wow, maybe Ernie doesn't have someone. And I'll be honest, I don't order my groceries online. I can't figure that out. So I thought if I can't figure it out, maybe Ernie needs that help. He ended up being very grateful for the offer and didn't need the help, but it was something that just popped into my mind. Is something as simple as that, can that be greatly helpful?
Absolutely. That's a fabulous solution. So a caregiver, neighbor, friend in someone's home can help in some very simple ways. Make sure they have bases covered. Do they have groceries? Could they fix a meal, or could you fix them a meal if you are in their home? Is their personal hygiene slipping? Do they seem like they're perhaps not meeting all of their needs? Is their lawn mowed? Or note when they are out, as you say, to ask a question. Make a friendly connection, just see how they're doing. So those basic ways are really important. Some people don't feel probably that they have a lot to look forward to in a pandemic like this. And in addition, we have other factors like storms and things like that we've had of late, which may also help to make people feel isolated.
Right. I know here on the West Coast, we're dealing with wildfires in the Bay Area. So it's almost like crisis on top of crisis.
I know.
I know that many older Americans may be dealing with, loneliness. And look, I'm 45 and I'm lonely, right? I've seen more than enough of my husband and my two children, but I miss being able to have those social interactions that kind of help boost my mood. How are older people specifically affected by loneliness?
Well, I mean, it can show itself in many, many ways, and particularly with relation to health. So people have a higher incidence of strokes, heart-related issues, and even depression, but particularly dementia. So when your brain isn't active, when you're not stimulated, when you're kind of in the same pattern each day, but perhaps without a lot of mental stimulation, that can quickly turn into something larger. And so we want to be very cautious of that.
Is that something where if someone does take a bit of a downward slide during the pandemic, once things become normal again, whatever that looks like, does that lift, or is it once I'm down there, I really do tend to stay?
You can't, for some who perhaps are predisposed to some of those conditions, then I could see at that point that they might stay. However, it is absolutely proven that having your brain stimulated and focusing and trying to do that each day, whether that's on your own or with the intervention of others, that you can change someone's brain patterns, and they can recover in some form from either depression or feelings of loneliness. and the kind of onset of dementia that can happen as a result of that.
I want to talk a little bit about what Synergy Home Care offers to people, but before I do, I want to address something that's come up many, many times in my talks with people in my situation. I have parents who are in their, mid to upper 70s. I've got two little boys of my own living in this house, and my parents want to see my children, but we're not getting them together because of the risk of COVID-19. Um, my parents miss their grandchildren, and they say it makes my day better when I get to see them, even just on the porch. Can you talk about that, kind of grandchild dynamic that for so many is now not existing?
I would say that I hear stories of this frequently, and I think the folks who fare best are the ones who have active participation of family members or friends or people around them. And so there are some simple things you can do. So you can up the ante as far as sending grandma and grandpa a card, even if it's a piece of paper folded over with a cute picture drawn on it. Maybe they can come watch a tennis match. They can come watch their granddaughter's tennis lesson on a Saturday morning. They can do something outside, plan a socially distanced appropriate affair where there is that comfort. And so perhaps we don't have to be completely removed from one another if we can find creative ways to do things safely. I think that's absolutely key, but definitely up the ante on sending people things. We can still receive mail. We can still receive package deliveries that are at an all-time high. So that's absolutely factual. The other side of it is that phone calls and FaceTime calls are worth their weight in gold.
Right. No, what did we do before FaceTime? I have no idea. Let's talk about getting some professional help. When it comes to Synergy, what sort of services does your company offer?
So we provide caregivers who come to people's homes and work in a variety of lengths of shifts, but we help people with things like personal care and meeting their needs. So perhaps getting out for errands, escorting them on an outing if need be, escorting them to a doctor's appointment, taking notes during that, reporting those findings to family, anything related to homemaking, so cleaning. Mobility support is a huge category. So for people who have slight limitations but are still getting along pretty well on their own, but maybe they have a few things that they're not feeling confident about, particularly things like moving around the house safely, getting in and out of the shower safely, in and out of bed safely. So mobility support is a big category. The other side of it is we work with clients of every age, so seniors included, but we also work with people who have disabilities and thus have mobility support concerns. We also provide memory support, and we reinforce any routines people have been given by their doctors. Sometimes the caregiver is the sweet reminder that once you get through that little exercise routine, you're best to do it daily. We can move on to something else that you're passionate about. So the caregiver can facilitate some of those things that keep people healthy and happy and engaged.
Is there anything that you could say from the professional perspective to those who are trying to do what you've described on their own, at home, with or for their parents, for example?
Well, I would say that, my experience of Synergy Home Care as a whole is that owners all over the country are welcome conversations. And so if a family member is struggling or they feel like, gosh, I just would like to get a little bit of respite, I think that's something that a caregiver can nicely offer. Maybe, make a little bit different connection with mom or dad or a loved one that the daughter or son is having trouble doing. Sometimes it's very difficult for us to hear again and again what we should be doing from someone we're blood related to,
Right.
like learning skiing from someone you love. Difficult, and so this rule can apply to seniors too. And so sometimes having just that little bit of outside support can be really helpful, or respite offered to a family member who's providing a lot of the care. That can be very pivotal for families. So there's lots.
Have you seen an increased demand for your company services because of or during the pandemic?
Absolutely. I think people are beginning to feel that we have enough information at this point that we've recovered to a level where they can conceive of having caregivers. We are functioning as ambassadors for all of the precautions for COVID-19, so we can also help in that way. So when we are in a senior's home or anyone's home, we help to sanitize surfaces, we display, how to wear a mask properly, we talk through all of these things, even help a senior wash hands. Maybe they can't stand at a sink and wash hands. So enforce those precautions. I think I've taken it and maybe forgot your initial question, but the idea is just to kind of help usher in those techniques that we're all following so carefully and allow them to understand what they are.
Right. I think a lot of people, with older parents who were doing fine before the pandemic are now seeing, either a steep or a, considerable slide. And they're thinking, wow, I never thought of hiring help before. I never thought of being the one to go over and do these things for my parents. But now all of a sudden, it's not in 5 years, it's now. So I think, sort of we at home are having that discussion ourselves. And I imagine that you on your end of things are getting those phone calls from people who say, I need that help.
Absolutely. Getting phone calls for just advice, but also getting phone calls for people realizing that maybe we've moved far enough down the road that they would consider having a caregiver. So I would say a definite uptick in inquiries.
And finally, for people who might be hearing of Synergy new for the first time today, where might be the best place online for people to learn more about your company?
There's a great presence with a wonderful website for Synergy Corporate, and so you can literally type in Synergy Home Care and get to a lot of resources. But be sure to click on the corporate website. There are also representatives all over the country in the form of different locations that are providing service to people in all parts of the U.S. Who are also happy to answer questions. But I would say the Synergy corporate website is an amazing resource. Definitely log on. Lots of just great ideas, great videos. It sets a tone for what a caregiver can really do and really offer someone.
Well, that's a smart place to start if we're looking to be either a good child or a good neighbor or just, a good citizen of our neighborhood and ultimately the world. So Julie Nagy, thank you so much for joining us.
You're welcome. Thank you so much. It's been my pleasure.